Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, followed by Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi conseiller Keith Egley, président du Bureau de la Santé, Councillor Keith Egley, Chair of Ottawa Board of Health, my apologies. We will also have available for questions from the Ottawa Hospital, l'Hôpital d'Ottawa, Joanne Reid, Executive Vice President, Chief Planning and Development Officer, Vice-présidente exécutive, chef planification et développement. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Dr. Vera Etches.
Good afternoon now. Hello, bonjour, kwe, enge. We are seeing a few encouraging indicators that the provincial shutdown measures, which began in December on the 26th, are starting to have an impact on the COVID-19 situation here in Ottawa. We've begun to see improvements in our test positivity rates. Fewer people are testing positive for COVID than in recent weeks. Individuals have fewer close contacts, and wastewater counts of the virus are no longer increasing. While we would still meet the criteria for a red zone in the provincial framework, this data should encourage us to maintain the behaviors that are working to stop COVID-19 transmission. As you've heard me say before, we do look at longer trends over several days and weeks, and this virus can always increase rapidly if we give it a chance. The numbers of outbreaks in institutions, workplaces, and social settings continue to grow as the level of community transmission is still high. So I know it can get tiring to hear this over and over. Until we have clear protection from vaccination, we do have the tools and we know what works to help slow that spread of COVID-19. Each of our individual actions matter, and we must support essential workers with the protections they need in the workplace. So we're aiming to get back to living with manageable COVID-19 levels where schools and more businesses are open. Keeping COVID-19 manageable will require attention to the basics for many months to come. I'm confident that Ottawans can keep doing our best to limit close contacts to those with whom we live, stay 2 meters apart from others when making essential trips, wear a mask, and wash our hands often. Pour gérer la COVID-19, il faudra continuer de porter attention aux éléments de base pendant de nombreux mois encore. Je suis convaincue que les gens d'Ottawa peuvent continuer de faire de leur mieux afin de limiter les contacts étroits aux personnes avec qui ils vivent, à garder 2 mètres de distance des autres lorsqu'ils font des déplacements essentiels, de porter un masque et se laver les mains régulièrement. This works to lower COVID-19 as we are currently seeing. So turning to the vaccine, where I understand there are many questions, I can tell you that we have more information. We'll continue to share with Ottawans who want to receive the COVID-19 vaccine. We'll continue to provide that. Right now, we have a variety of resources on our website, including general information, sequencing of who is next to be offered the vaccine, and answers to the most commonly asked questions, and in multiple languages, such as Somali, Arabic, Spanish, and simplified Chinese. Nous continuons de mettre à jour une variété de ressources sur les vaccins sur notre site web, y compris des informations générales l'ordre dans lequel les prochains vaccins seront offerts et les réponses aux questions les plus fréquemment posées, dans plusieurs langues telles que le somalien, l'arabe, l'espagnol et le chinois simplifié. So I'm also pleased to share that we are now publishing the number of COVID-19 vaccines supplied and administered in Ottawa. Starting today, we're also including the long-term care home resident vaccination coverage for the first dose, as well as total doses received in Ottawa by date. Je suis également heureuse de vous annoncer que nous publions maintenant le nombre de vaccins contre la COVID-19 qui ont été distribués et administrés à Ottawa. À compter d'aujourd'hui, nous incluons les données sur le nombre de résidents en foyer de soins de longue durée qui ont reçu première dose, ainsi que les doses totales reçues par date. So these numbers will appear in the Ottawa Public Health COVID-19 Daily Dashboard under the Vaccination and Testing tab, and it will be updated 3 times per week, Mondays, Wednesdays, and Fridays. I can appreciate the level of interest in data related to COVID-19 vaccines, and we will keep adding information as it becomes available. So earlier this week, we launched the 5th phase of our online engagement survey, this time with a focus on vaccines. Plus tôt cette semaine, nous avons lancé la 5e phase de notre sondage sur l'engagement en ligne, cette fois en mettant l'accent sur les vaccins. So this is another tool that will help Ottawa Public Health determine what questions and concerns Ottawans have related to the vaccine. It will tell us about residents' plans to be vaccinated, how they feel about the new vaccines, and who they speak to about vaccines. So it will also give us an understanding of the benefits and challenges people are having and other behaviors and attitudes toward vaccines. While this pandemic is unprecedented, vaccines are not. Ottawa Public Health is here to support and ensure residents have the information they need to make informed decisions for themselves and their families. So we encourage residents to have their say, share your ideas. This phase of engagement will close on February 12th, 2021. So please visit engage.ottawa.ca/COVID-19. Nous encourageons les résidents à s'exprimer et à partager leurs idées. Cette phase de mobilisation prendra fin le 12 février 2021. Veuillez visiter participants.ottawa.ca/COVID-19. So Ottawa Public Health continues to consult with the province to discuss measures to reduce the transmission of COVID-19 in Ottawa and open schools as soon as possible. Reopening and keeping schools open is a top goal of our pandemic response. At this time, we understand the concern about the rate of infection in the community having implications for introduction of COVID-19 into schools. La réouverture et le maintien des écoles ouvertes constitue l'un des principaux objectifs de l'intervention en cas de pandémie. À l'heure actuelle, nous comprenons la crainte que le taux d'infection dans la collectivité ait des répercussions sur l'introduction de la COVID-19 dans les écoles. So we appear to be turning the curve in Ottawa, and Ottawa Public Health is ready to support a safer return to school with an added emphasis on the daily screening and testing for people with symptoms to keep COVID-19 out of schools. We are working with school boards to reinforce the infection prevention and control measures that limit COVID-19 transmission in schools. We understand this is a challenging time for parents, and we're asking all employers to please continue to be understanding if employees who are parents need to have more flexible schedules. Additionally, parents can find resources and support on our Parenting in Ottawa website, including helping your children cope during the pandemic, back to school and learning at home resources, and frequently asked questions. Je m'excuse, il y a quelqu'un avec une alarme juste à l'extérieur de ma maison. J'espère que c'est pas trop le bruit. Les parents peuvent trouver des ressources et du soutien sur notre site web Être parent à Ottawa y compris des ressources pour aider vos enfants à faire face à la pandémie, la rentrée scolaire et l'apprentissage à la maison, ainsi qu'une foire aux questions. So I'd also like to acknowledge the hard work of all our teachers and the school staff, what they've been doing to try to provide our children with virtual education. We know this hasn't been easy for you either. We see you and we appreciate you. J'aimerais également souligner le travail acharné de tous nos enseignantes et du personnel scolaire pour offrir à nos enfants une éducation virtuelle au cours des dernières semaines. Nous savons que cela n'a pas été facile pour vous non plus. Nous vous voyons et nous vous apprécions. So we continue to see school-aged children and youth testing positive for COVID-19. The testing must continue even if children are not attending school in person to help make our schools safer when they do return. Le dépistage doit se poursuivre même si les enfants ne fréquentent pas l'école en personne pour rendre l'école le plus sécuritaire à leur retour. Although children have been participating in school virtually, the infection does spread from children to members of their households and to others in the community. And this spread has resulted in added pressures on the healthcare system. It could lead to the extension of the lockdown. So just testing and self-isolation are important tools that help decrease the spread in the community. So please visit ottawapublichealth.ca/COVID testing for more information. Finally, just a word about mental health. Again, monitoring our mental health is important. Last week, Ottawa Public Health published our latest status of mental health in Ottawa during the COVID pandemic report. Its findings indicate Ottawa residents are continuing to report worsened mental health and emotional well-being, loneliness, weaker community connectedness, and concerns about burnout. This time of the year can be difficult for many, let alone during a pandemic. So these next few months, I want to encourage everyone, keep tabs on your mental health. Cette période de l'année peut être difficile pour beaucoup et encore moins pendant une pandémie. Ces prochains mois vont être une période difficile pour beaucoup de gens. Donc, j'encourage tout le monde à garder un œil sur votre santé mentale. For my family, this means setting realistic expectations. We can't do all the work we want or keep the house as tidy as we want or cook every meal from scratch. We choose to focus on things that are most important for our family. We prioritize getting outside every day and making use of our local park, which does wonders for our mental and physical health. It is normal to feel anxious, afraid, stressed, or burnt out as we continue to navigate this COVID-19 response. And while this situation is stressful for everyone, people living with mental illness and addictions may be finding it especially difficult to cope. If you or someone you know is struggling, there is help. Remember, no matter where you are or what you're going through, you don't have to go through it alone. Si vous ou quelqu'un que vous connaissez éprouvez les difficultés, il y a de l'aide. Rappelez-vous, peu importe où vous êtes ou ce que vous traversez, vous n'avez pas à le traverser seul. So please reach out. Many free mental health resources can be found on our website. Let's continue to look out for one another. Be kind, be safe, and stay well. Thank you. Merci, miigwech.
Thank you very much, Dr. Etches. We will now be hearing from Anthony DiMonte.
Thank you, Kina. Good afternoon. Bon après-midi. I'd like to start off by echoing Dr. Etch's message that we all must continue to follow the direction of the province and our public health officials to limit the spread of COVID-19 in our community. And while the case count in Ottawa has come down somewhat recently, our numbers remain a concern. Et même si le nombre de cas à Ottawa a légèrement diminué dernièrement, les statistiques sont encore préoccupantes. We're certainly not out of the woods. This is why it's so important to follow the provincial orders, including the stay-at-home order. From last Thursday, when the stay-at-home order came into effect, to Sunday, our bylaw and regulatory services team received more than 200 requests for service regarding the provincial orders. These included many requests for information, but also complaints about social gatherings and open of non-essential businesses, and people not following the stay-at-home order. Upon investigations, officers found that a large number of these complaints were unfounded. Nevertheless, we did have to issue charges under the Reopening Act of Ontario. Five total charges, 4 related to indoor social activities at private residences, and 1 for opening a non-essential business. We also issued 5 verbal warnings, 2 for mask issues and 1 for opening of a non-essential business, and 2 for unauthorized gatherings. I know this is a difficult time. Residents are tired, but we have hope. We started administering the vaccine and we are making progress. Je sais que ces temps-là sont difficiles et que les résidents sont tannés de la situation. Mais la lumière est visible au bout du tunnel. L'administration du vaccin est commencée et progresse très bien. The city's Emergency Operations Center, in collaboration with Ottawa Public Health, the Ottawa Hospital, are working to vaccinate eligible residents against COVID-19 in accordance with the provincial distribution framework. The Ottawa Hospital has been receiving the Pfizer BioNTech vaccine since mid-December. The vaccine supply for this week will be used to administer second doses to ensure that those individuals who have received their first round of vaccinations become immunized as directed by the province. Last Friday, the federal government announced that there would be a temporary delay in Canada's Pfizer BioNTech vaccine shipments, and yesterday it was reported there will be no shipments next week. This means that the city will have fewer doses than originally anticipated in the next few weeks. La ville recevra donc moins de doses prévues au cours des prochaines semaines. As a result, the province also announced new direction with respect to second doses. Long-term care residents and high-risk retirement homes and their essential caregivers who received their first dose of the Pfizer vaccine will receive their second dose in the 21 to 27 days. Staff who were vaccinated at the homes at the same time as the residents will follow the same schedule. All other recipients of the Pfizer vaccine will receive their dose between 21 to 42 days. Most of the vaccines administered to date have been administered at the Ottawa Hospital Clinic to workers in long-term care and retirement homes, essential caregivers, and healthcare workers in high-risk settings. Once it was confirmed that Pfizer vaccine could be transported, we quickly mobilized our efforts in order to reach residents in long-term care homes. And I'm pleased to say that we progressed well with our mobile vaccination teams in our community. J'ai le plaisir de vous informer que nos équipes de vaccination mobile ont travaillé avec efficacité dans la communauté. As of last Friday, the first dose of vaccine has been made available to residents, workers, and essential caregivers in all 28 long-term care homes. More than 92% of all long-term care residents received their first dose of vaccine. I want to take this opportunity to thank the city's mobile vaccination teams, which consist of Ottawa paramedics, Ottawa public health nurses, support staff for their great work in administering the vaccine, and staff from the Ottawa Hospital in Chio, and staff and caregivers of the 20 and 28 long-term care homes as well for their support. Given the availability of vaccine supply, 1 high-risk retirement home and 1 congregate home with older adults have also been provided the opportunity to receive their first dose of vaccine. Both homes were experiencing exceptional health concerns, and as a result, and at the direction of Ottawa Public Health and Dr. Etchers, we prioritize the administration of vaccine to those 2 additional sites. As I mentioned earlier, our next steps will be to administer the second dose to those individuals who have already received their first dose of the vaccine. Depending on the vaccine supply we receive from the province, which we will know will be minimal in the next few weeks, we will then shift our focus to the high-risk retirement homes. We will then proceed to other priority populations identified under phase 1 of the province's distribution plan. We will have a more detailed information for you about our vaccination rollout at the technical briefing that we will be holding next Monday, January 25th at 2 p.m. Nous vous transmettrons d'autres détails au sujet du déroulement des activités de vaccination lors d'une séance d'information technique prévue lundi prochain, le 25 janvier à 14 heures. I want to reiterate today that it is going to be a longer process, and it will take some time to get all residents vaccinated. This is why it's important that we continue to follow the provincial orders and the direction given by our medical officer of health in order to reduce the spread of COVID-19 in our community. We all have a role to play. Stay at home unless you need to take an essential trip, such as a medical appointment, go to the pharmacy, or get grocery, or for exercise. Nous devons tous collaborer pour assurer un bon déroulement du processus. Restez à la maison, sauf si les déplacements sont essentiels, comme un rendez-vous pour un rendez-vous médical, aller à la pharmacie ou à l'épicerie, ou à faire de l'exercice. Remember to limit your household contacts to those living in your household. Wear a mask, practice physical distancing, and practice proper hand hygiene. Let's continue to work together to help bring our numbers down and limit the spread, as the light at the end of the tunnel is still there and vaccine will come back and arrive, and we will continue to distribute throughout our community. Thank you very much. Merci beaucoup.
Thank you very much, Mr. Diamante. So I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we will now start with Joanne Chianello at CBC Ottawa.
Hi, first, okay. I guess my first question are about schools. Dr. Etches, can you talk a little bit about what you're recommending to the province? They should be like saying later today, I guess, what regions are opening, but what is your view on whether schools should open now, and as well, what do you want to see to reopen schools? You say, yes, we're here to reopen them safely. What does that mean? What do the numbers have to look like? What additional measures maybe do we have to take as a community or even as a health organization? Thanks.
Thank you for your question. What we wanted to see was getting away from what concerned us and led us to support school closures at the end of December leading into January, which was that rapid rise in the level of COVID in our community. We needed to see that turn around. We didn't know where that rapid rise would take us, how high that would get, and the speed at which it was changing made it very challenging to think about being able to manage the COVID in the schools without further disruption to families. So what we want to see, what we're seeing now, is that we appear to have, at this point, started to turn that curve. And what it requires with this higher level of COVID in the community is that parents screen their children every day to assess if there are any symptoms like a cough, a fever, a sore throat, stomach ache, runny nose. There's a screening tool. It's the same screening tool that should be used daily. And if their children meet the requirements for testing, that they're going for that testing to make sure it's not COVID and to keep COVID out of the schools. It also requires again, speaking to parents, but anyone who's looking after children, that we limit children's contacts to the people in their household when they're, not in school. School has the screening, school has the cohorts, school has infection prevention and control measures, the mask use. All of those things need to be reinforced, and we can't increase the likelihood of transmission of COVID among children by restarting extracurricular activities. So those need to be still off limits. It's still stay at home, except for when children go to school. That's their essential work to do. And so that's the approach we need to take. Stay at home is still there. We still have a ways to go to get the COVID levels lower. And so I hope that answers your questions.
Yeah, I guess this is not my follow-up. I'm always worried. But I guess I was also looking at what your recommendation was to the province about whether schools open Monday. As I'm sure you know, many parents are anxious to know that.
Yes, so I'm only speaking for Ottawa. I don't know what the plans are across the province, but certainly indicating that we are ready to support schools opening on Monday.
Okay. And again, we don't know whether they will, right? We're waiting for the province still to answer that. Okay. And I also have a question then for, I'm not sure if it's for Mr. Diamante or whoever else is on the call on the vaccines, moving to vaccinations. As we know, we have no vaccines next week coming into Canada. Do you feel you have enough to get that second dose to everybody who needs it? And as well, I know that there are some seniors homes that we're looking for, retirement homes that we're looking for to get vaccinated. Do you have any kind of timeline about how much that's going to be delayed? If you can sort of address that a bit.
Yeah, thank you, Joanne. So as this announcement was just made, the teams are working really hard. Our colleagues at Ottawa Hospital rather, are doing that math as we speak. So two things to your question. With regards to the retirement homes, I think that's going to be a challenge until we start seeing a significant amount of vaccine arrive. We unfortunately won't get to that next tranche that we wanted to. Our first priority will be those in long-term care that got their first dose. We want to ensure that they get their second dose in the time frame that has been identified. And then the other groups of the specific healthcare workers that did get a first dose, particularly those who are working in long-term care, we want to make sure that they get their second dose. So that's kind of what we're working on right now as we speak, and we should have clarity of that in the next couple of days. With regards to do we have enough for second doses, we do have a number of vaccines. The N is not what we've already vaccinated, so there's going to be a challenge there. And to be candid, we are waiting for direction from the province. They are looking at this across the province and what that means. And our public health colleagues, have got spreadsheets that they have to report back, and I think they're mapping that out now at a provincial level as well, too, not just Ottawa. So in the next couple of days, we'll have more clarity on that. But as I said, and I know Dr. Etches has said it several times, our first priority has been the long-term care residents. They were the most critical, the most vulnerable, as we saw, and we've got the first dose, so we've got to make sure that we get the second dose there. But the next couple of days, Joanne, I think we'll have more clarity, and we'll certainly be able to share that with you then.
Thanks so much to both of you.
Est-ce que c'est possible d'avoir en français la réponse sur est-ce qu'on va avoir assez de doses pour la deuxième dose du vaccin?
Oui, M. Paquette. Donc, essentiellement, ce que j'ai dit à votre collègue, comme comme on vient juste d'apprendre qu'on n'aura pas de vaccin la semaine prochaine et dans les 2 autres semaines, on va avoir un nombre limité de vaccins qui va arriver à Ottawa. Dans notre processus actuel, l'équipe de l'hôpital d'Ottawa, où on reçoit les vaccins, sont en train de faire l'analyse des chiffres, à savoir ceux qu'on a déjà vaccinés et est-ce qu'on a assez de vaccins pour la deuxième vaccination. Ce qui est clair, et comme le Dr. Etches nous avait indiqué, les groupes les plus vulnérables, dont ceux dans les CH, les centres hospitaliers de soins de longue durée, ont reçu leur première dose. C'est ces gens-là qu'on veut assurer qu'ils ont immédiatement leur deuxième dose. Et par la suite, on va voir avec la province de l'Ontario ce qui reste et comment qu'on va gérer les gens qui ont déjà eu leur première dose. Comme j'ai indiqué à votre collègue, la problématique qu'on a, on voulait aller aux résidences de personnes âgées comme deuxième tranche. On ne sera pas en mesure de faire cette première attaque-là, si vous voulez, parce qu'on n'a pas assez de doses. Donc, on veut s'assurer que tous ceux qui ont eu leur première dose reçoivent leur deuxième dose. Le travail se fait au moment qu'on se parle par l'équipe de l'hôpital d'Ottawa, par l'équipe de Dr. Etches à Santé publique Ottawa. Et on doit également faire rapport à la province parce qu'ils sont en train de faire une analyse sur l'ensemble du territoire de l'Ontario, quel impact que ça va avoir. Et dans les prochains jours, on va savoir quel est le processus que le gouvernement de l'Ontario va vouloir qu'on mette en place pour, si vous voulez, s'adapter à cette nouvelle réalité.
Merci.
Thank you very much. Merci beaucoup. Moving on, we will go to Eric O'Brien at City News Ottawa.
Thank you. Good afternoon, everyone. So my question is for Dr. Etches. Now, has OPH, and maybe just a follow-up to the first question that was asked, has OPH received any provincial directives from the province on in-person school, on students going back to school in person?
No, Ottawa Public Health will most likely hear about the decision being made the same time that the rest of the province does through the announcement from the province.
Okay. I want to ask you about the purpose of your letter to the Ottawa Carlton District School Board. It kind of seems like you're preparing parents for extended closures. What was the purpose of the letter?
Yeah, I hear there's been a little bit of reading into that because we mentioned that the coming month will be difficult for families. I think we are speaking in general, not specifics there, that this month has been difficult for families. And, if school closures continue, that does continue that extra pressure that families are facing to balance work and school and parenting. It's a hard time with the weather, with the limited options for people as we stay home. The stay at home message is still there for the full duration that the province had said, the 28 days. So we just wanted to acknowledge that for parents and offer some resources and some support that's online. Let parents know that we see this. We need to work together to try to make it through the toughest time.
Thank you. That's all for now.
Thank you, Eric. We will now go to Josh Pringle at CTV Ottawa.
Thank you very much. My question is for Mr. DeMonte. As of Monday, there's about 3,400 doses remaining of the Pfizer vaccine in Ottawa based on the Ottawa Public Health Dashboard. Will all those vaccines now be saved to administer the second doses to people that have already received the vaccine, including in long-term care homes, for the next little while?
So as I indicated, the work is being done, and I apologize. I just see my colleague Joanne Reid of the Ottawa Hospital there, who's probably more in tune with the work that her and her team are doing, the tremendous work they're doing. So we're doing those numbers now. Josh, as I indicated, and as Dr. Etches has told us multiple times, our priority is to get the long-term care residents protected as quickly as possible. That's why with the mobile teams, we went out really hard and fast, and we got a very successful program with the participation of everyone to get them all done in short order. Now our next question is, when can they get completely protected with their second dose? So all the work that's being done now is to arrive at some analysis as to what we have left, how can we achieve that, and then what are the next steps. And I know we will be getting direction from the province. They're now compiling that across Ontario, and they will be giving direction as to the state of the province and what we should be doing. But as I said, I'm remiss I didn't see Joanne was on. I'd give Joanne an opportunity if she wants to add anything to that.
Thanks, Tony. No, I think you covered that quite well. I think we are really following the guidelines from the province, and same as Dr. Etches has said, is that the focus is on the planning to make sure that we provide those second doses to the long-term care residents, long-term care home residents, and we're working through that plan and that modeling at this point to, the goal is to secure additional doses going forward so that we can meet the demand as per the provincial guidelines and federal guidelines.
My follow-up question then, with the focus now on long-term care homes, does that mean that some of the hospital staff and some of the other healthcare workers that did receive the first dose in late December and early January will wait closer to 42 days for that second dose so you can focus on long-term care homes?
I can perhaps start. That is, sorry.
You go right ahead, Tony. No, that's perfect. Thank you.
I was just going to say that is the analysis I think that's going to get done. It's quite more than likely, and I've talked to colleagues around the province. They're in similar situations as us. We had got what we call a battle rhythm, right? We were vaccinating people, first doses, the second dose would arrive the week after, and things were moving. Now with this hard stop, we have to put a pause. We have to do the math, as we say, to ensure that we've got what we need. And I think that's a very similar situation across the province. So it is quite possible that those other healthcare professionals that got their first dose may have to be extended into a timeline that's up to closer to the 42 days. But again, that is the work that Joanne and her team are doing here locally, but it's being done across the province, and that's going to be funneled up to the provincial task force to make that decision of what we're going to do. So we're focusing right now with what we have. Let's get a second dose to our most vulnerable, our long-term care. Then the data is being provided, and then we'll get direction from the province. But I think, Josh, your analysis is probably something that's valid, and that's likely what will happen.
Thank you.
Thank you very much. We will now go to Craig Lord at Global News.
Thanks very much. This is probably for Anthony DeMonte. You mentioned that you made the call to get the first dose into a congregate care home and a retirement home that were especially high risk. I was just wondering how much flexibility does the city's vaccine task force have in making the call of where to prioritize doses as it pertains to the province's directives?
So, Craig, thank you for that. And I'll let Dr. Etches. So I didn't make the call. I supported Dr. Etches' call. So the provincial directives are quite strict. That said, the local medical officer of health in any situation, in any emergency, has to analyze the local situation. At the time, we had some capacity. Again, I want to compliment Joanne and her team. We were in a moment where we were getting regular volume, so thought we could continue our work, and then we could target these two facilities that were in crisis, but identified by Dr. Etches and her team. But in general terms, it is dictated by the province, the order, the hierarchy. But there's always, these one-off circumstances that are truly exceptional. That it's at the call of the medical officer of health. But I'll let Dr. Etches weigh in if she wants to on that question.
Thank you, Tony. So, in fact, we were following the provincial priorities for phase one. The provincial priorities for phase one are long-term care home residents and workers and essential caregivers, and then retirement homes, workers, essential caregivers, and residents. So we have 36 high-risk retirement homes, and the one retirement home that we went into is one of those 36 high-risk retirement homes. So we were starting on the next, priority of the province. The other congregate care setting we went into is also in the first phase of priority populations, which is congregate care settings where older adults are living together. And so again, in both of these situations, there were a much higher risk of spread of COVID that needed to be addressed. So I'll repeat what Mr. DeMonte said. We follow the provincial priority framework, and then we implement it locally, but there is always a need to identify within those larger priority groups, where do you start? And so that is the work that we do locally. And it's not just me. In fact, I'm not actually directly involved in the committee that is looking at how we sequence vaccine. It's a committee it's our sequencing task force. It's under the city's emergency response framework, and it's made up of community members from groups that are at higher risk, who are more affected by COVID, along with healthcare providers. It is co-chaired with one of my associate medical officers of health, Dr. Trevor Arneson. So there's a transparent process to go through and get agreement on what needs to happen locally under the provincial framework for prioritization. How do we apply that locally? So this is the work of that sequencing task force, and we can describe this more at our technical briefing as well.
Thanks very much, and maybe I'll just follow up directly on the sequencing question. Under phase 2 of the province's directives on vaccine distribution are adults aged 80 and up. I'm wondering, do you see any reason to more prioritize adults maybe 65 and up, living outside of long-term care settings, who are described as the most vulnerable but seem actually rather low in the sequencing order under the provincial directives?
Certainly, there are a lot of discussions ongoing right now with the province about how to proceed past this initial situation we're in with limited supply, and age is a top factor to consider. There is no question. We definitely need to start with people who are over 80, then over 75, then over 70, then over 65. If you look at who is dying, who is being hospitalized, it's completely related to age. And then there are other variables that increase risk or not. And so these are the things that are being used to guide those prioritizations. And I think we'll get more detail about exactly how things will proceed once we're past this initial limited supply.
Thank you very much.
Thank you, Craig. Thank you, Dr. Etches. Nous allons maintenant passer à Julien Paquette à le droit.
Bonjour, je crois que la question va être pour M. Dimonté. Bon, on n'aura pas de dose du vaccin Pfizer la semaine prochaine, mais il y en a un deuxième, il y a celui de Moderna. Est-ce que vous avez reçu des nouvelles de ce vaccin-là? Et si oui, de quelle façon est-ce que ça pourrait vous aider à atteindre vos objectifs de protéger les personnes les plus vulnérables à Ottawa?
Bon, merci Julien. Deux éléments. Premièrement, Moderna, on a eu des quantités limitées distribuées à l'Ontario parce que Moderna, comme vous le savez, est plus facile à transporter. L'objectif a été de donner Moderna pour le transport vers les Premières Nations dans le nord de l'Ontario, dans les communautés éloignées. Et donc, le groupe qui ont un objectif d'immuniser ces gens-là a eu la grande majorité de Moderna. Moderna aussi a été distribué dans les 4 zones de la grande région de Toronto pour augmenter le nombre de vaccins qu'ils ont. Pour l'instant, nous n'avons pas eu de nouvelles à savoir si nous allons avoir Moderna dans la région d'Ottawa. Mais je vous rappelle, on a utilisé Pfizer comme première dose. Et donc, la deuxième dose qu'on doit avoir pour ces gens-là qui ont reçu la première dose doit être Pfizer encore. On ne voudrait pas substituer, si vous voulez, maintenant Moderna à quelqu'un qui a eu Pfizer comme première dose. Donc, ça devient un problème ultimement technique à cet égard-là. Mais pour l'instant, nous n'avons pas eu de nouvelles à savoir si Moderna va arriver en grande quantité, quand est-ce qu'on va l'avoir dans la région d'Ottawa. Pour nous, un ou l'autre aurait un impact, mais on aimerait recevoir plus de Pfizer si ça serait disponible, mais on va voir. Et peut-être je laisserai la parole aussi à Dr. Etches si elle voulait commenter peut-être au niveau scientifique un élément à ce égard-là. Elle dit que non. Fait que, Julien, c'est la réponse.
Oui, je me doutais que ça ne pouvait pas être un substitut pour la deuxième dose, mais peut-être pour accélérer dans les maisons de retraite et autres. Donc, ma deuxième question serait pour la Dr. Etches. Bon, évidemment, le focus, c'est la réouverture des écoles, mais bientôt aussi, il va y avoir la question de la réouverture de certaines entreprises, des restaurants et autres. Est-ce qu'il y a déjà eu des discussions sur la façon que cette ouverture-là pourrait avoir lieu?
Je n'ai pas avis pour la réouverture des entreprises à ce moment. C'est trop tôt. Encore le nombre de personnes qui ont un dépistage positif pour la COVID-19 est haut encore. Et c'est juste le début de platir la courbe. Et la priorité maintenant, c'est d'avoir le service essentiel pour les enfants, les écoles ouvertes, et on a besoin de regarder l'impact de cette action. On a besoin d'attendre pour cette période de 28 journées de le message de la province de rester chez eux. Mais après ça, on va voir quelle couleur est-ce que Ottawa est dans le guide pour la province pour la réouverture des entreprises.
Merci.
Merci beaucoup. We will now be going to John Willing at the Ottawa Citizen.
Thanks, Kina. It's a question about long-term care homes, vaccination rates, but with regards to the workers, and I'm wondering if you have any quantitative data to say how many LTC workers in Ottawa have received the first dose, who are offered the first dose and who have received the first dose. And if you don't have the quantitative data, I'm wondering if you have a sense as to what the take-up has been for LTC workers.
Maybe I can take a crack at it. To be candid, John, no. That data right now, I know the team is looking at splitting it up because I think it's going to be an important element and criteria to analyze. But right now, no, we have a macro understanding of each of the long-term care facilities. And I want to just remind you why that's a little more complicated, because as you remember at the beginning, we couldn't move Pfizer. So the long-term care workers were going to the Ottawa hospital to get vaccinated. And then when we were able to move Pfizer, we moved into a mobile model where we went into long-term care. And so the analysis is being done now of who's what as well, and it's just a product of the tools that we have that are given to us by the province. It's it's just broadly who was vaccinated. It doesn't do the specific analysis whether it was a resident or a long-term care worker. But we're working on that right now. So I suspect in the next little while, actually, it's Vera's team with the Ottawa Hospital that's working on that. I suspect we will get some of that, but unfortunately I don't think I have that. We won't have that data right now.
Okay, thank you. Just jumping off that, are you receiving any anecdotal, I guess, information back from long-term care homes, if there's been any barriers to getting workers vaccinated or convincing workers to agree to take the vaccine?
I have not heard anything of that sites, but
Yeah,
I'm looking very tactically. So maybe Dr. Etches may have a sense that I don't.
I can tell you, I think it has been an enabler to bring the vaccine to the sites where people are working. That seems to be clear. We've had feedback. I haven't directly, but the team has, and if Joanne wants to add anything, but when people are able to be vaccinated during their workday, the work hours, they're there, that seems to be facilitating things.
Yeah, no, Dr. Etches, I would agree. I think that in the beginning, I think there was a little bit of hesitancy, but I think as time went on and people came to get vaccinated, we've seen more. Plus, we extended the hours at the clinic until we were able to get the mobile unit to go. So I would say that the mobile unit is definitely the more effective and efficient way. But in the beginning, I think just extending the hours helped as well. So,
thank you all.
Thank you, John. We will now go to Joanne Loshes at Ottawa Sun.
Hi, I have a question about the extension to up to 42 days. I take it that is something that the research has proven is a window that is still effective for the second dose?
Vera, I can speak to that. The 42 days comes from the National Advisory Committee on Immunizations' latest recommendations with regard to COVID vaccines. Their recommendation is, of course, to follow the dosing schedule as much as we can, as recommended. But in the context of limited supply or uncertain shipments coming, that jurisdictions can maximize the number of individuals that are getting the benefit from the vaccine by going ahead with the first dose and delaying the second dose up to, preferably within 42 days. That comes from the period of time that was seen in some of the studies the companies did. But we currently don't have data on the maximum interval between doses or on medium-term or long-term effectiveness of COVID-19 vaccines under different scenarios. But as a general principle for other vaccines, when the schedule is interrupted and a following dose is going to come later than the typical schedule, it usually does not require restarting the series. And when we look at using, again, what we know from other vaccines, principles of immunology, historical examples, we do see that delays in doses do not tend to affect the final outcome in terms of the durability of the memory of those, the immune system response, or even in the final antibody concentrations. But we don't have that kind of study right now for this vaccine.
Thank you. One follow-up question. I understand that the outbreak at the Valley Stream Retirement Home is quite a serious situation. Can you tell me a little bit more about that?
I don't have details about individual outbreaks. I know our typical way of working is to make sure that the infection prevention and control measures that need to be in place are in place, and that the homes are, supporting their staff, providing adequate levels of staffing, and to be able to carry out those infection prevention and control measures. And my understanding, is that the team has said that they're working hard, and this is a situation where that they're following the public health guidance.
Thank you.
Thank you very much, Joanne. We will now be going to, nous allons maintenant passer à Antoine Trépanier à Radio-Canada.
Oui, bonjour. Si possible aussi de répondre en anglais pour mes collègues, ça serait apprécié. Ma question est pour M. Desmonté. Par rapport aux big box, les grandes entreprises que le gouvernement de l'Ontario a décidé de cibler dans les derniers jours, est-ce que vous pouvez me dire un peu qu'est-ce que vous pensez de cette initiative-là qui, en ce moment, est surtout dans le Grand Toronto, Hamilton, très peu à Ottawa? Et comment vous palliez à ça aussi de votre côté? Est-ce que vous avez des mesures similaires à celui du gouvernement de l'Ontario ici dans la région?
Oui, merci, M. Trépanier. D'une part, aujourd'hui même, on a eu un avis de l'équipe de Toronto qui vont être dans la région d'Ottawa la fin de semaine prochaine pour une opération. Je vous rappelle que on avait déjà fait ce genre d'opération-là au précédent. Lorsqu'ils arrivent, ils se coordonnent avec nos gens des règlements municipaux, ainsi que le service de police également, et on travaille en équipe. Souvent, l'équipe de la province ont des gens des ministères qui sont différents, qui ont des juridictions différentes que nos gens de règlements municipaux. Donc, on va avoir des gens du ministère du Travail, etc. Donc, ils vont faire l'analyse lorsqu'ils rentrent dans ces big box stores-là, de choses qui sont différentes de nous. Actuellement, nos agents de règlements municipaux font des visites au big box store et s'assurent que l'ensemble des règlements sont respectés. Donc, c'est quelque chose qu'on fait actuellement. Et on répond également aux plaintes dans les big box stores également. Donc, ce processus-là est déjà en cours. En anglais maintenant, vous voulez, c'est ça?
Oui, s'il vous plaît.
Oui. So with regards to big box stores, previously the government of Ontario had mobilized different ministry inspectors that are different than our bylaw and regulatory inspectors and look at different parts of different laws. For instance, the Ministry of Labor, ensuring that employees and the employer relationship is being covered, their health and safety, that type of process. They were concentrating in the Greater Toronto area. As a matter of fact, this afternoon we got advised that they will be coming to the Ottawa region this weekend. And like last time, they will be linking up with bylaw and the bylaw team and the Ottawa Police as well with those different ministry inspectors. We'll be visiting the big box stores here in Ottawa. So we've got experience. We've done that previously. The second part of the question was with regards to what are we currently doing? Bylaw and Regulatory Services are currently ensuring that the current requirements, both of the Provincial Act and the medical officer of health orders, are being respected in those stores as well. And we're following up on complaints and any issues that we have right now. But this team will be doing their blitz here in Ottawa like they've done in the GTA. And as they've done last time, I suspect will continue across the province of Ontario.
Merci. Et mon autre question est pour Dr. Etches. Vous avez dit que la situation s'améliore, c'est positif, mais il faut toujours être vigilant. Comment vous expliquez, en fait, cette amélioration-là à ce moment-ci dans le processus de confinement? Et qu'est-ce qui doit être fait plus précisément pour continuer cette baisse-là? Est-ce qu'il y a d'autres facettes qu'il faut maintenant s'attaquer? Par exemple, des plus de réglementations entourant les big box, par exemple, ou autres alternatives comme ça?
Au base, le succès avec la diminution de COVID-19 dans nos communautés, c'est à cause de la séparation entre eux. Quand COVID-19 n'a pas contact étroit entre différentes personnes, on ne peut pas être transmise. Alors, c'est important de continuer avec les mesures d'avoir distance entre les gens qui sont dehors votre foyer. Et quand on travaille ou quand on va au service essentiel, utilise les masques quand il n'y a pas la distance. C'est la base, ça fonctionne, c'est la raison on peut diminuer le COVID-19. Alors, c'est important si les gens continuent recommencer avec l'école, c'est important de continuer avec les mesures d'éviter contact entre les différents enfants de différentes maisons dehors les écoles. Ça va être important encore. Et vous m'avez demandé concernant la question de les grands magasins, c'est toujours important d'éviter les foules. Alors, si on peut aller magasiner dans un temps moins occupé, ça c'est meilleur. Et je pense que ça répond à votre question.
Oui, merci.
Merci beaucoup, Antoine. Thank you, Dr. Etches. This is all the time that we have. Thank you, Mr. DiMonte, Chair Eglai, Ms. Reed. C'est tout le temps que nous disposons aujourd'hui. Bonne journée. Have a great day.
Thanks very much.